The Broward College Respiratory Care Program is accredited by the Commission on Accreditation for Respiratory Care. The program has been in existence since 1968 and has earned an excellent reputation in the community for graduating high-quality respiratory therapists. More than 90% of students that graduate from our program find employment in our local hospitals as well as throughout the country. A respiratory therapist functions as a member of the healthcare team in the hospital setting and is responsible for maintaining a patient's airway. Being able to breathe is a life function that may require several types of treatments. If a patient is not breathing, it becomes necessary to use different techniques to breathe for them. Bag valve mask ventilation is used for a few minutes until a tube can be placed in the trachea. Once this tube, called an endotracheal tube, is correctly placed in the trachea, the patient can be attached to a ventilator that can breathe for them. It is important to ensure the tube is placed in the trachea. If the trachea is missed, the tube will be accidentally placed in the esophagus and air will enter the stomach. A person can die after 4 minutes of not receiving oxygenated air in the lungs. A respiratory therapist receives extensive training using machines called ventilators that breathe for someone. The ventilators are high-technology devices that are used with the following: newborn babies that were born prematurely and their lungs are not fully developed, children who are post-surgery or critically ill and this has affected the normal functioning of their lungs, such as heart transplant patients, adults who have stopped breathing, or adults in severe respiratory distress who need assistance with their breathing. Ventilator training occurs in the respiratory labs during the second and third semester of the program. Once the student can demonstrate that they have learned the concepts of mechanical ventilation, they are assigned to ventilator patients in the hospital, in the critical care units, as well as in the long-term care units. Respiratory therapists deliver medication to a patient's airway by utilizing devices that can change a liquid into a mist that can be inhaled. Several different types of devices are used for this purpose. A respiratory therapist can also evaluate a patient's response to therapy by listening to breath sounds, observing a patient's breathing pattern, taking vital signs, and by measuring the amount of oxygen in the blood. A new technology used for delivering additional oxygen to a patient is called high-flow oxygen therapy. The student in the photo on the right is learning how to set up the equipment for the high-flow oxygen therapy. A very fast flow of warm, humidified oxygen is delivered through the patient's nose. This fast flow of air creates a positive pressure which then improves their oxygenation. This is more effective than many other oxygen devices. An important part of treating a patient with lung disease or with other diseases that lead to a patient feeling short of breath is to look in the patient's medical record and evaluate the information. Knowing the chest x-rays, lab values, and other information about the patient's history helps in the decision-making for determining what the proper care of the patient should be. A respiratory therapist also spends part of their day teaching patients and their families about lung disease, how best to achieve a more comfortable way of breathing, or they teach patients and families about the equipment and other respiratory care modalities. A respiratory therapist draws blood from the artery. This is the blood vessel that pulsates. Arterial blood comes directly from the lungs, so it becomes the best way to evaluate if the lungs are providing enough oxygen and getting rid of excess carbon dioxide in the blood. Another procedure performed by a respiratory therapist is a pulmonary function test. While using sophisticated equipment, the patient is instructed to perform a deep breath and fast exhalation. Information is collected that can diagnose whether a patient has a lung disease. Although most respiratory therapists are employed in the critical care areas of the hospital, such as the newborn intensive care unit, adult intensive care unit, and pediatric intensive care unit, there are other areas where a respiratory therapist may be assigned to work, such as the emergency department or the medical surgical floors in the hospital. Outside of the hospital, some respiratory therapists are employed in pulmonary rehab centers and long-term care centers. A respiratory therapist is part of the air transport team and assists in bringing patients from other hospitals or other states, countries to the hospital where they are employed. The base pay for respiratory therapists starting out in their career is approximately $23.50 per hour, according to surveys completed by the Broward College Respiratory Care graduates. The National Bureau of Labor and Statistics reports an average pay of $27.78 per hour. Additional pay of approximately $3 per hour is added to the base pay for night shift work. Also, a second additional pay of approximately $3 per hour is added for weekend work. A typical work week for a respiratory therapist is 3 12-hour shifts per week. There are many unfilled respiratory therapy positions in area hospitals as well as throughout the country. Memorial Regional Hospital currently has several open positions, as does Broward Health. These are hospitals that are part of the clinical rotation during the program. About 90% of graduates from Broward College are hired into positions upon graduation. Many employers approach the students while they are still in the program and offer them a position at the hospital. Upon graduation from the program and successful completion of the 2 national exams that qualify you to become a registered respiratory therapist, other opportunities become available to advance your career. Successful completion of the NPS exam earns you the credential of RRT-NPS. Successful completion of the first year of working in critical care in the hospital qualifies you for the CCS exam. This exam earns you the credentials RRT-CCS. The following slide outlines the respiratory care program requirements and admission criteria. For the physical requirements, the respiratory therapist is required to pull and push heavy objects as well as assist in moving patients to and from stretchers, wheelchairs, or beds. They are required to position patients and assist in lifting, moving, and restraining patients. The respiratory therapist is required to stand and walk for extended periods of time and must be able to bend, stoop, kneel, and run. Hearing must be sufficient to hear and evaluate breath sounds and heart sounds and identify various monitors, alarms, and voices typically heard in the hospital. A complete list of technical standards are listed on the program's website. For the admission criteria, the program starts in August. The minimum GPA is 2.5. The prerequisite courses need to be completed before applying. The application period is March 1st to June 1st of each year. Applications are processed in the Health Science Admissions Department. Applicants with the highest prerequisite GPA are selected first. These are the courses required to be completed prior to submitting an application to the Respiratory Care Program. If a higher level course is taken and the grade for the higher level course is better than the lower level course, the higher level course will be used to determine the prerequisite GPA for the student's application status. You will be notified by your Broward College email only once you have been accepted. You will be required to complete a physical exam, complete certification in CPR, American Heart Association only, and background check and drug screening through American Data Bank. Graduates of the BC Respiratory Care Program enjoy a high pass rate on the national exam. More than 90% of graduates pass the national exam and become registered respiratory therapists. The Associates of Science degree in Respiratory Care is awarded upon completion of the 2-year course of study. Graduates are eligible to sit for the NBRC National Exam, the Therapist Multiple Choice Exam, and the Clinical Simulation Exam. The cost is $400. Upon successful completion of both exams, the graduates become a registered respiratory therapist. A state license is required and costs about $165. This is the schedule of courses for the program. After the prerequisite courses are fully completed, an application can be submitted. All of the respiratory courses must be taken in order. It is not possible to take a Term 2 respiratory course before passing all Term 1 respiratory courses. All general education courses can be taken at any time and do not have to follow the suggested format listed. For example, microbiology is offered in Term 3. It can be taken before entering the program or during another semester. Clinical courses begin in the 2nd semester of the program. Although the clinical courses show as a 3-credit course, you are in the hospital clinical 2 8-hour days, Wednesday and Friday every week, until the program ends. Usually the clinical hours are from 6:45 a.m. until 3:15 p.m., although on occasion there are some 3 to 11 p.m. clinical hours available. Once admitted into the program, it takes 21 months to complete. The total estimated cost for the AS degree is $11,053. The cost of national exams and state license is $565. This total cost includes books, course fees, hospital uniforms, stethoscope, physical exam, background check, and certificates. The location of the program is on North Campus, Coconut Creek in Building 41. Clinical rotations are offered at Broward Health Medical Center, Memorial Regional, Joe DiMaggio, and Memorial West. For contact information, please email the Health Science Advisor. For questions about the Respiratory Care Program, please email the Program Manager. Also, make sure to check out the website has more in-depth information about the Respiratory Care Program. This includes a breakdown of the course times for each semester. You will also find links to our professional organizations and contact information for the program personnel. Hope to see you soon.